Hi viewers, this is Dr. Harshvardhan Reddy, consultant cardiologist from Sravani Hospital, Madhapur and Kukatpalli. This Valentine month, that is February, okay. So love your heart as a routine. So there is not much required for maintaining heart health. So only minimal exercises, maintaining good sleep, reducing stress can take care of your heart health. So you don't need much of strenuous exercises. Generally we prescribe only moderate cardio exercises for heart health. Even excessive like resistance exercise like weightlifting, all those generally not advisable. So just maintain your routine. At least start with 10 minutes of routine brisk walking is enough for your heart, and gradually you can increase up to 30 to 40 minutes. At least 5 days a week is more than enough. So apart from this, sedentary life is one of the risk for the heart. Like whenever you are sitting for longer duration, at least in between for every 40 minutes or 1 hour, just stand up and maintain some stretchings, all those things. That is enough to maintain for your heart health. So after the exercise, the second thing will be sleep. Sleep is one of the risk factor. That is, lack of sleep is one of the risk factor for the cardiac health. Like at least 7 to 8 hours a day sleep is compulsion. That way, not with the interruptions. You should have a continuous sleep of 7 to 8 hours, so that your sleep goes into REM sleep, where you will have good relaxation and it will reduce the stress hormone. Generally, lack of sleep increases cortisol and all those stress hormones, which are more risk for the heart. After this the maintenance of stress. So how can you maintain the stress? Whenever you feel stress, calm your mind. How can you calm your mind? Like you can do some simple breathing exercise, like 2 minutes of breathing exercise, where you just inhale for 4 seconds, later maintain exhale for 6 seconds. At least 4 to 5 cycles of these things can take care of your or reduce your stress. Or if you find any other ways to calm your mind, like meditation, all those things you can do, so that you can maintain or you can reduce your stress. So even lack of risk factors, or even lack of symptoms, like don't feel that cardiac will present only with the symptoms like chest pain and all those things. Sometimes it will give time or something like that. You don't feel like that. So because heart attacks, all these things will present without prior signs. Okay. So this month of heart and health, to identify some unknown risk factors or something what we call subclinical risk factors, like diabetes, hypertension or dyslipidemia, all these things, they will not have any symptoms. So don't feel that they present with symptoms or something like that. So without symptoms itself, we have to go for the health checkups, where we can identify these submerged symptoms, and we can manage, so that they will not go into complications like heart attacks and all those things. During this Heart and Health Month, we are conducting a campaign, that is Sravani Abhayam, where you can find out the risk factors, which will not present with the clinical symptoms, by health checkups. So you can register your phone number and your name and phone number of yours or your loved ones, so that we come to your home and collect samples. If any risk factors is identified, you can come and checkups. They are nearly free. After that, we can maintain your health through our Sravani Abhayam concept.